Hello, welcome everyone. Welcome everyone to this seminar on CoMiSS and Pre-CoMiSS. So we have two speakers. After me, Professor Rosan Meyer will talk about evaluating the need for shared decision making in the cow's milk allergy journey, and I'm Yvan Vandenplas, based in Brussels, and I will give you the introduction lecture to explain you why we developed Pre-CoMiSS. So I'm sure you all heard about CoMiSS, which is the cow's milk related symptom score that we developed now over 10 years ago. And in the meantime, during these 10 years, we have over 40 publications in the peer-reviewed literature using CoMiSS as an awareness tool for the diagnosis of cow's milk allergy. So it's a tool to make healthcare professionals more aware about the possibility that the symptoms that the child is presenting are caused by cow's milk allergy. Probably you all know also that we published with ESPGHAN last year a new position paper on the diagnosis, management, and prevention of cow's milk allergy, in which we put several statements, and we said one of those statements is that the baseline CoMiSS milk-related symptom score and its reduction during an elimination diet may be indicative for cow's milk allergy, but is not diagnostic. And then also the same year, Rosan was the first author, and I'm part of the DRACMA group who published the new recommendations or updated recommendations of the World Allergy Organization. And one of the statements in these documents regards also CoMiSS, and it says that the cow's milk related symptom score was developed to raise awareness about the fact that such non-specific symptoms may also be caused by non-IgE mediated allergy. So it means that CoMiSS has got a place now in position papers, guidelines about the diagnosis of cow's milk allergy. So at this meeting, there are at least 4 presentations related to CoMiSS, and it's more focusing now on normal infants. So there was yesterday a poster presented on the crying behavior in over 2,000 healthy infants. Tomorrow I will give a presentation on regurgitation, and there is also a poster on the development of the centile charts for CoMiSS in those presumed healthy infants. And we collected over 2,500 data from healthy infants from Europe, Mexico, Brazil, Indonesia, and Egypt, so from all over the world. So the focus is now on normality, in trying to help to reassure parents about those frequent manifestations. And that led us to understanding the need for Pre-CoMiSS, which is now launched and which a parent-specific cow's milk-related symptom score, and it's a qualitative study. Because you can look at it how you want, but the use of digital tools in healthcare is absolutely increasing. And we know very much that a parent who has an infant that cries or regurgitates or has stool problems or has atopic eczema goes on Dr. Google and looks for what is happening and is there a solution. And you see how the use of those digital tools is increasing. Just another example with something with Turkish colleagues that we developed is a web-based questionnaire to evaluate risk factors to develop cow's milk allergy, which was just recently published in the European Journal of Pediatrics. So for regurgitation, what do we know in fact? that if you asked retrospectively parents about the severity of symptoms, they tend to overestimate. This is data from a trial comparing two thickened formulas, and one of the inclusion criteria or de-inclusion criteria was that parents had to say that the baby was regurgitating at least 5 times a day per day since at least 1 week. But before inclusion in that trial, before starting the management, we asked parents to just record during 3 days without any intervention how frequent those infants did regurgitate. And then 30% of those infants actually regurgitated much less. So retrospective, taking a history on regurgitation, parents tend to overestimate. And if you look in literature for crying and colic, you can find exactly the same if you ask retrospectively at the moment of the consultation, how severe is the crying, how much do your baby sleep? Our parents always seem to overestimate. So then we consider that CoMiSS is in fact a tool which is used by the healthcare professional when the parents come to the consult. And we know now from literature that prospective collection of data is preferable. Therefore, we developed the Pre-CoMiSS, which is a tool that parents can find on the web that they can fill in prospectively and come with that information to the healthcare professional. And that Professor Rosan Meyer is going to tell you everything about the Pre-CoMiSS. So, Rosan.
Thank you, Yvan, for that kind introduction. I wanted to start with my first saying that it's such an honor to be here and also to talk about a topic I think that's touching us all in regards to making shared decisions when it comes to healthcare of the patients. These are my disclosures, including, of course, this presentation that I'm giving. So, as Yvan was already saying, that parents are more and more seeking online health support. And already in 2020, there was a systematic review indicating that 9 out of 10 parents will go onto Google prior to them coming to see a healthcare professional. At that stage, there was some data leaning towards the more educated parents and also the age between 30 and 42. What the information has also shown is that if parents go and seek information online and they then actually share it with a healthcare professional, and we as healthcare professionals react in a positive way, it can really improve the patient-healthcare professional relationship, and it can really help with communication strategies. And this is 5 years ago. That was before ChatGPT, for example, really took off. So when we're thinking about the decision-making process, and this is from a publication now several years ago that I did, is we're not talking about the parent, the healthcare professional. We have a triangle now that says parent, healthcare professional, and we have the online tools that they use. We know we talk about Dr. Google, but I would say ChatGPT now becomes a very big part of the decision. So when we make a decision with the parents, we know that somewhere social media, internet, ChatGPT would have played a role to make that decision. This is something that we looked at in regards to cow's milk allergy and thinking about the tools that we've got online. So a group of us looked at between Germany, Australia, US, UK, all of the English-speaking tools that are available. And we found 10 online tools with the vast majority of them being aimed at parents. Out of all of those tools, there was only one that was validated out of all of the questionnaires that were supposed to support the diagnosis, and that was CoMiSS. And you've seen we've got a huge library of studies that have supported the validation. There was one study from Gibbons talking about a pilot study on a non-IgE mediated tool, but nothing ever happened. We felt then as a group, that there was a need to somehow come out with guidelines with what are the tools that are available and what should they adhere to for cow's milk allergy. So we did a Delphi consensus, and I've highlighted just a couple of them. I know for those of you at the back it's very small, but basically what we're saying is that whilst there are many tools that are available, at the end it's still a healthcare professional that needs to make the diagnosis. And as Yvan has said, the CoMiSS tool is an awareness tool, is not a diagnostic tool. So that's the first and important factor. The second aspect is that whatever tool is online should be validated for what it's supposed to do. Then we have another one that the symptoms that are listed should also be symptoms that are associated with cow's milk allergy, because we found all kinds of very interesting symptoms listed for parents to take for cow's milk allergy as well. We also said that any of the questionnaires, they should be clear who developed them. They should be open if they've received any financial support from industry. And we've always, as the CoMiSS scientific board, been very open around the support that we've received. And importantly, that they should be supportive of breastfeeding. Taking all of this into account, when you're looking at specifically allergy patients or parents and what their use is, I'm quoting 2 articles, but there's much more than that. We see that actually above 70% of parents prior to their visit to a healthcare professional, if their child has got symptoms that they associated with allergy, they will consult online tools. One of the studies in 2022 on qualitative assessment found that the parents were more likely to go for tools or questionnaires that have been developed by healthcare professionals that they trust. And so with this in mind, we as a CoMiSS scientific board took the leap of faith and said, well, maybe we need to develop something, a tool that is based on a validator tool to raise awareness that supports that decision-making that healthcare professionals have to make to actually aid a communication between healthcare professionals. So I'm going to take you through the process of what we did. We started last year in January, and what we did, we looked at CoMiSS and first of all adjusted the language. I will show you where the language adjustment comes. We removed the score. We did not want to have parents have access to a score because we did not want them to think this is a diagnostic tool. Then we had a prototype. We went out for a first round of qualitative assessment. The qualitative interviews were taken independent of us as the scientific board. We were allowed to listen in. We provided, though, very clear protocol and included parents of children that were between 2 months and 12 months that had symptoms of cow's milk allergy but were not diagnosed with a cow's milk allergy. So the first round happened in the UK and happened in Germany. We then had a meeting with the feedback. We refined the tool further. Then we decided that we needed more opinions. And we went back. Another round of interviews took place, both parents, healthcare professionals, this time in Sweden and then in Spain. Again, feedback, refining until we had the final tool. And then, of course, this publication, which I've just shown you, which was is available open access from last week. The tool is a very simple tool. And when you go onto the site, the first thing is you've got both healthcare provider and parent the tool available. What is important from the tool is that we ask the parents when they complete the tool, we first of all say it's not a diagnostic tool at all. Secondly, we ask them not to make any changes to their feeds, not anything to breastfeeding, not anything to formula feeding. No change. We provide no nutritional advice. Then we have the 5 different limbs matching CoMiSS. The first one is crying, and I know it's small for you, but each tool, so we've got crying, we've got stools, we call it poo because parents felt that was language that was more normal for them. We have respiratory symptoms, then we have spitting up, and then we have also skin symptoms. Critically, in all of these areas, we start with what is normal. So we focus on normality. As Yvan was saying, most parents will overestimate how much a child regurgitates. So we provide first guidance on what is normal because we want it to be reassuring. We then provide guidance on how they assess symptoms. So they can then go and say, based on my child, this is what I see. Importantly, no score. No score. You just document. And then what you get out, and again, I know is small, but it's a little PDF that is you can print out. The little PDF basically provides you with all of these different categories, the symptom the child has. It gives also a summary. The child is 3 months of age, for example, is breastfed, is bottle fed, is on complementary foods. And we also ask parents to rank the impact on quality of life, because we felt that when they come to see a physician, if that is also an important factor to take into account. So now your question, I hope, would be saying, Rosan, this is lovely. What do I do as a physician now if they bring this tool in? So what happens is the parent tool absolutely mimics the healthcare professional tool, just with more parent-friendly terminology. When they come with that tool, it absolutely matches the symptoms, what you'll get on the professional tool. The only difference is you will still, as a healthcare professional, need to score it. So then it's you that needs to score. And of course, then for us, a score above 10 raises awareness, not a diagnosis. It raises awareness to use. Think about cow's milk allergy within your consideration of a diagnosis. So I wanted to show you what we then did and what the healthcare professionals and parents said. So we took this tool to parents. We took this tool to healthcare professionals. So I'm first of all going to talk about 18 healthcare professionals. And we have a little scale here to look at, first of all, awareness of CoMiSS and also interest of CoMiSS. And what you can see is that UK and Spain had the highest awareness and also interest in having this as an awareness tool. Germany was significantly lower, and while Sweden was interested, the awareness was lower. But reassuringly, physicians fed back that they feel quite confident in the diagnosis of cow's milk allergy and have knowledge around this. The concept of having a pre-CoMiSS was well received. However, Germany, the doctors highlighted the concern that maybe this will drive parents to come more to see healthcare professionals, and it may increase anxiety. And I'll come to that because, of course, for us, that's important that we also consider that as well. What all of the healthcare professionals felt was that the strength comes with the normality, because we focus absolutely on what is normal. And so if we go to what the parents are saying, because that is also important, we had 5 different themes. The first theme of the parents was infant feeding routine and history. So all of the parents were coming to us and saying, okay, we do realize that there was a change in symptoms when we switched, for example, to formula. So that was a first theme that they were very aware of it. Then the next question and theme we had was, what action did you take once you were aware? So all of them were like, they spoke to their primary care physician about that. So that route of shared decision making, I am going to my primary care physician to ask about these symptoms. The next one was the concern regarding symptoms of feeding. So that's why we focused on normality, because all parents had some concerns, and the concern and awareness in terms of cow's milk allergy was very high and making a lot of the normal symptoms pathological within the UK. So that's one of the reasons we really wanted to focus on normality. The next theme was the source of information. Where do you go to from a source of information? And all of them were very much talking about healthcare professionals, but websites online was featuring as a primary source. In terms of the impression, all parents had a very positive impression around the pre-CoMiSS. And I'm just giving you one quote, which I think really summarizes it from one of the parents from Germany who said, this tool just gives you something right away. It helps me during a conversation with the doctor. So you are part of that. You need to be more self-determined in what you want examined. So I thought that was quite positive. So if we're thinking about the triangular service, of course, all of you will say, okay, let's think about what are the positives and possible benefits. Is the fact that it may save time, that you have somebody already with some of the symptoms. It reduces the burden of decision, so helps you with taking a shared decision with the parent. But there is also the concern. And the concern is, of course, the bias that parents that complete this questionnaire. It's also the concern that you have unnecessary healthcare professional visits, and also the concern about overdiagnosis. And for us, that is a real concern. And we know that the data has been published. This is from the EAT study, that if we just used symptoms and you don't think about a diagnostic criteria, that you will overdiagnose. And that's not the objective. I know I've said this 3 times already. It's an awareness tool. It still requires you as a healthcare professional to go through the motion of diagnosis. And so for us, this is something we will be further assessing. We as a team are research driven, and that is not something that we will just let go. So in conclusion, internet, social media, ChatGPT is part of our parents' life now. And in regards to cow's milk allergy, we do know that most parents, prior to them coming to see you, they will have looked at online resources. So Pre-CoMiSS has been developed with parents and healthcare professionals. You can read the full paper. It is focusing on normality. So that is the big thing. It focuses on normality. The parents cannot score it. It's just there to support that discussion you have with your healthcare professional. It is linked, as I hope I show you then, to the professional side where you can then score it. And again, it's not a diagnostic tool. And for us, this is a journey. We will take it forward. We will look at, does it create anxiety? Does it lead to overdiagnosis? And we take all of the feedback back and watch the space for further publications. And I want to take this opportunity. I'm just representing this amazing group of people. So thank you very much.
Thank you very much, Rosan. So there is some time for interactive discussion. We are looking forward to get some questions from you. All right. If there are no questions, who thinks this is a useful tool? Raise your hand. So the majority does not raise its hand. So you think it's not useful? No? You have a question? Please go to the mic.
Hello, thank you for your presentation. It's very interesting. I'm from Argentina, and I want to know if the Fred bunnies, it will be available in Spanish.
Yes. CoMiSS is already available? No. It will become soon available in Spanish. They are working on the translation.
The CoMiSS already is translated.
No?
Yeah.
CoMiSS is already available in Spanish.
Yes, so
CoMiSS will then come soon, and it will come in several languages which are used a lot in the world. Yes, please.
I'm actually interesting. I'm from Ireland. Was there a section, or is there a way of looking at medications? Some children may have previously started on co-leaf drops, Gaviscon. Is there a way of kind of looking how medications might kind of, impact some of the symptoms the babies are having, or is it just looking at babies kind of feeding symptoms?
So It is primarily looking at babies' feeding symptoms. We did not want to bring medication. It makes the tool a totally different tool if you start.
Yeah.
Because what we go from the principle and is that we trust the physician, the healthcare professional to take that. So this is really to bring the symptoms. But we do have, like I said, we provide some basics that complementary foods have been introduced.
Yeah.
And actually what I didn't say, we do also talk around the concerning symptoms. For example, they have had severe IgE-mediated rashes, blood and stool. So we do have a tick box there, so that the physician knows immediately this is the child that there was blood or there was a rash and it was related to. We also talk about illness. So for example, if there's a rash, we have every time saying, remember that it's normal for children to have rashes with viral illness. But what we don't do in regards to regurgitation, saying, have they had Gaviscon? Have they had PPIs? Because we think that is really a physician. Would you agree?
I would fully agree, and indirectly not related to CoMiSS, but when there was an information campaign in the UK to make healthcare professionals more aware about cow's milk allergy, you saw a decrease of the use of medication. So one of the indirect intentions is also to bring reassurance and to not hopefully overdiagnose cow's milk allergy, and also then if you bring reassurance to decrease the useless prescription of medication. So it gives to the healthcare professional a tool in hands to say to that parent, look here, what you saying is completely within normal ranges. So instead of just communication, now the healthcare professional will have also a tool about normal behavior in those infants.
Right. Thank you so much. Thank you.
Hello, it's a good job. The Pre-CoMiSS for the parents. I can ask questions. Low growth, low blood stool. Why?
Well, we voluntarily did also not put altering growth failure into CoMiSS, because we think that's a serious symptom which needs investigation, and for which cow's milk allergy is only one of the many possible causes. And we were afraid if we put these kind of symptoms like blood in the stools, faltering growth into CoMiSS, there might be too much focus on cow's milk allergy by the healthcare professional and not considering other reasons which might be severe diseases for the child. The same is true for anaphylaxis. It's not part of CoMiSS. It's obviously an allergic manifestation, but which needs immediate intervention. So it does not need a score because you need to go to the emergency in case of anaphylaxis. So that's why it's not included, and also not included in Pre-CoMiSS, because you also do not want false reassurance. Because of course overdiagnosis is something you want to avoid, but reassurance which is inappropriate because there is something severe going on, that's certainly something you do not want. So therefore these symptoms are not included.
Thank you very much.
Yes, thank you very much. I have a question regarding the stool characteristics. What is that characters that indicates common allergy? I know blood, mucus, diarrhea, and constipation also. What is the color? Is there any importance of the color? Change black, greenish, grayish, like this. Does it have any significance?
Okay, we only look at stool consistency and not at color, because color depends on so many factors. whether the protein is hydrolyzed or not in the formula of the baby, if there are biotics in that formula or not. So it's just looking at stool consistency. And again, blood in the stools is not part of it because it can be very benign, but it can also be a manifestation of something very severe. And all symptoms have to be present for at least 1 week. So in case of acute disease, it's shorter duration than 1 week. So
I also want to say that I think all of us that look at the stools of a baby, the variation is so huge as a single symptom to say based on stools by itself. So we do say, you're looking for a combination of symptoms. So you'll see we use the Brussels Spitz stool chart. And I think if we score only that as abnormal, you will not get to that. So you need to have multiple symptoms. So what we don't want is on one single symptom to say you've got cow's milk allergy.
Okay, thank you very much. Time is over. We will close the session and thank you for your interest.